our next session will be led by Dr. Heather Beal, who is the founder and president of Blocks. She will moderate Exploring the Gaps in Evidence. So with this, Heather, it's all yours.
Well, good morning, everybody. Oh, I'm sorry. Good afternoon, everyone. It's still morning here. I'm only on my first cup of coffee. So we've invited this panel that you're going to listen to now and to interact with to help sift through the noise and pull out some of the major gaps in evidence and understanding. One of the objectives of the workshop that we've talked about here today is to better understand the current gaps and future opportunities for supporting the coordinated delivery and restoration of services following major federally declared national disasters. Today, I have here with me Lori Peak, who is the director of the National Hazard Center at the Center of Colorado Boulder. Lori is a prolific researcher and writer about children in disaster and has seen more than a few gaps in her studies. Amanda Rivera, the executive director of the Youth Development Institute of Puerto Rico. Amanda, as I understand, is a prior school teacher and a current research policy and advocate. And through her experiences, like with Hurricane Maria, she's going to provide a more recent perspective of how the needs of children are being addressed and maybe talk to some of the progress since Hurricane Katrina in that effort. Also, we have David Schonfeld, who's a developmental-behavioral pediatrician and professor at the University of Southern California and the Children's Hospital in Los Angeles. David was one of the original members of the 2010 National Commission on Children in Disaster. The National Commission, as you all know or may not know, first identified a lot of these gaps, and his expertise in this historical venture will also help highlight the progress and gaps made since that time. So now I'm going to turn it over to each of our panelists to share a few thoughts. So we'll get started with Lori.
Nice. Thank you so much, Heather. And Heather, thank you for all of your work and the work of the organizing committee to draw all of us together. This has just been like eating a very rich meal, so thank you. And I just want to again say thanks to the sponsors for this workshop, to ACF and HHS for all of the support, not just for these 2 days, but all of the support in this area. And Roberta, that was just a really fantastic overview this morning, so thank you for setting us off. So as Heather said, my name is Lori Peak, and I am so happy to join you again today for this specific panel, which is focused on exploring gaps in evidence. And I'm very honored to be here with the other panelists today. And we were really given a rich list of possibilities for us to think about in terms of what we might want to share today. And so from that list, and in the time that I have today in the panel, and I know most of this panel is actually going to be dedicated to Q&A. And so in my brief time today, I really picked out where I would like to speak briefly a little bit about both progress and gaps in terms of child, youth, and family needs, and then also in terms of an ongoing project on support for service providers. And so the questions that we were given by the esteemed organizing committee and the National Academies were for us to really think about where systems are falling short, why they're falling short, and then I added this part, and what we might do about it. And so in order to talk to you today, I'm actually going to draw on that chapter that I referred to yesterday at the end of the talk that I gave at the end of the day yesterday. And so this chapter is called Recognizing Vulnerability and Capacity, Federal Initiatives Focused on Children and Youth Across the Disaster Life Cycle. And I worked on this with my wonderful graduate student, Simone Domingue. And so the main contribution of this and what I wanted to share with you today is what we really do in this chapter is we offer a summary and a descriptive analysis of all of the federal programs geared specifically at children and youth, as well as available guidance documents aimed more at caregivers, schools, child care centers, and other child-centric institutions that we could find. And so what we did this sort of exhaustive internet search. We talked to our colleagues in the federal government who we knew were working on different child-centered programs, so we could continually be building out this list. And so what we did was we summarized what's the name of the program, the document, or the resource, what federal agency or set of agencies sponsored the program, and then we offered an overview of the program, and then we looked at the target age group of the program so we could figure out, are most of these looking at teens or young children, et cetera, or the audience. And so first, the big news. As Natalie Grant said yesterday, thinking about sort of what a dramatic shift Hurricane Katrina has led to in terms of the focus on children and families. One of the things we found in this analysis is since 2005, we were able to find either programs or guidance documents from numerous federal agencies, including FEMA, the U.S. Army Corps, NOAA, the National Weather Service, the NIH, EPA, HHS, of course, the Department of Ed, CDC, the Department of Justice, as well as the FBI, the U.S. Geological Survey, and the Department of Homeland Security. So the good news, one, since 2005, children have increasingly been recognized as both a vulnerable group, but also in our review of these documents and associated websites, it's not just a vulnerable victim sort of frame that is being brought to these resources and these materials. Children are also increasingly being depicted and brought into emergency management activities as a real capacity and resource. Also, as you just saw with all of those logos up on the screen, a wide range of federal agencies are now involved in offering child and disaster-focused educational programs and/or guidance documents aimed at parents, caregivers, or other persons who are responsible for the health, well-being, and care of children. So that's the good news. Now you're getting ready to see how I organize my entire life. Start with the good news, but then let's talk about where was the gap. So here are some of the gaps that we identified. There is wide variability in how much participatory engagement, which is sort of best practice for children and youth, how much participatory engagement is available in these. Most of the programs available focus on personal or household preparedness. Most of the programs available are focused on emergency planning and response, and oftentimes children are really depicted as a monolithic group without taking into account their full diversity. So this is both the focal areas, but also given this sort of where we're at, that leads to potential opportunities. So real opportunities moving forward is ensuring that as we're developing guidance documents, curricular programs, and so forth, that we center the active engagement of children and youth. We know that's how they learn best, how messages stick best. So more active engagement, more movement towards collective empowerment models and co-production of services. And so sort of moving beyond the individual and thinking about individuals in interconnected webs and how children, youth, families, entire communities can work together to achieve the change that we are trying to promote in terms of preparedness for children, families, schools, and childcare centers. Also, more focus on child-serving institutions. Most of the available documents, again, are focused on individual children or households, with less on childcare centers, as we heard from Heather yesterday, schools, and so forth. Also, with the focus on emergency preparedness and response programs, there's far less guidance on how children, youth, and those who care for children and youth can actually engage in mitigating disaster losses and be involved in long-term recovery. And then finally, very important to move beyond sort of the monolithic child and to think about the incredible diversity and to use an intersectional lens, to quote Natalie Grant again, and how we can do this best. So I'm going to end my comments today just briefly with another sort of focus area on support for service providers and what we might do better. And here, I'm going to draw on some of our early findings from a collaborative project focusing on voluntary organizations active in disaster that the Natural Hazards Center is doing in partnership with Save the Children. And so what we're trying to figure out in this project at its heart, we recognize and honor the role that voluntary organizations active in disaster play in getting services to affected communities. And we're trying to figure out how can we build the capacities of VOADs to ensure that children's needs are taken account of. And so in this project, we're focusing on 2 states, the state of Nebraska and Arkansas, as our 2 initial focal states. And our project goals are first to assess what is already available in terms of child-specific knowledge, skills, and attitudes in the 2 state VOADs. And what we learned from those 2 states with our initial survey work was that the VOADs reported that they had relatively low levels of knowledge about children and youth and disasters, relatively low skill sets, but high levels of desire to learn more about children and youth. Then in steps 2 and 3, this is where Save the Children's leadership is coming in that they've actually created program interventions to increase VOAD and emergency management knowledge and awareness and to advance the prioritization of children's needs. And then thinking about this project like a full life cycle, what we're doing at the Hazard Center is then assessing the project interventions to see if they're actually achieving those goals. And so we've done baseline surveys, participatory asset mapping with VOAD members in the 2 focal states, GIS mapping to understand more about where children are in the states and where potentially vulnerable children are using the CDC Social Vulnerability Index. And then finally, we've also done social network analysis, which I'm going to end today by just showing you a little bit of that. And so the big questions that we're doing with the social network analysis work is that we're trying to understand things like the 4 C's are at the heart of everything that the VOADs do, related to enhancing and deepening communication, cooperation, coordination, and collaboration. It's extraordinary the efforts within these VOADs to move forward. So we're trying to measure the state of the 4 C's, understand how much engagement there even is with non-member child-serving organizations, and then how child-specific resource exchanges between VOAD member organizations and these child-focused experts, how that actually works. And here's where I'm going to end. And so this is just a tiny snippet of the social network analysis data that we were able to collect in partnership with Save the Children and from these wonderful representatives of these VOADs in these 2 states. And this is showing just a bit of the Arkansas data. And so we were trying to understand things about just how do these VOADs like exchange different forms of resources, including information as resource, equipment as resource, training as resource, but also child-specific resources. And here's the takeaway of all those dots you see on the screen. That the VOAD said that they, and that's why the image on the left of your screen is so intense, that they seek information from each other the most, but they seek child-specific information the least. And here are the final 3 things I'm going to say about why I think that's so and what we might do about it. So number 1, if you look at the image on your right of your screen, what you can see are several dots that are just floating around there. And what that means is those are actual VOADs who they're seeking no child-specific resources. And that may be because they think they don't need them, but it also, what we think it is, it's not that they don't think they need them from our other survey work. What we think is going on is that they don't have accessibility to them. So number 1, some VOADs aren't even able to seek out those resources even when they say they need or want them. Number 2, when they do seek out resources, you can see in that right-hand graphic, they're all going to one node, and that one node is Save the Children. And so that leads to the third point, because Save the Children did the intervention, right? And so that leads to the third point, which is if we could increase the number and integration of child expert nodes in these VOADs, if we could increase those resources, then undoubtedly we're going to be able to increase that information seeking activity. And that's where I think we can begin when we see these expansive gaps. How can we begin to close them is through bringing that resource and that expertise together. And with that, thank you for listening today. And I just wanted to say that this presentation, as well as yesterday's, is dedicated in loving memory to one of the many teachers that Alice Fothergill and I met along the way in our study, Rose Cropper, who just recently left this world, but was an advocate for children her entire time in this life. And so thank you to all of you who are advocates, and thank you for listening today. And thank you again, Heather, for the moderating and opportunity.
Thank you, Lori. We really appreciate it. Next, we're going to turn on over to Amanda. Amanda, we'll get the screens sharing sent over to you, and off we go.
Hi, good afternoon. I'm going to share my screen, so just bear with me for a second. Make sure this does not. Let's see. Okay. All right. So I'm going to speak today about the experience of Puerto Rico with Hurricane Maria. So it's going to be a more localized account. We are the Youth Development Institute of Puerto Rico. So we're the Kids Count partner in Puerto Rico. And we're kind of this hybrid between an advocacy entity and a think tank. And the reason why we're that hybrid is because in Puerto Rico, there's not a lot of entities doing policy and research and advocacy work. So we kind of had to bring everything in-house as we've evolved in our work. And our main focus is on reducing child poverty in Puerto Rico. But when Hurricane Maria came, it was such a massive event, and it altered so many things. And we knew that there was going to be a disproportionate impact on children living in poverty, which, by the way, are the majority of children living in Puerto Rico, 58%, that we had to pay attention to what was happening. So everything I'm going to share today is based on the two initiatives that we developed as a result of Hurricane Maria. One was that we conducted a study, a very comprehensive study on the impact of Hurricane Maria on children. We did a representative survey, extensive qualitative work, just to understand what were the areas most impacted, and we can share that with you later. And also, we eventually ended up leading the Puerto Rico Children and Youth Task Force, which originated as a result of Hurricane Maria and was actually started by efforts between ACF and Save the Children. So I'm going to, before I go really quick, give you a context of children in Puerto Rico, just so you have an idea. And I also think it's helpful when you think about maybe, even though the context in Puerto Rico is about the whole island, I know that there's jurisdictions like, for example, New Orleans after Katrina that had similar demographics. And I think these demographics really, from what we saw, especially in the study, confirm that the scenario gets even more complicated for children when you're in a community where the vast majority of children and families are already living in poverty. So there's less resources all around. So 58% of children live in poverty. That percentage varies 1 or 2 percentage points, has done so for 20 or 30 years. You know, some of the characteristics, 78% of these children are living in single parent families, which mostly headed by a mother, which is also really significant when we think about the resources and the supports that they have at home. 29% of families with income up to the 130% poverty level do not qualify for the NAP program, which is the Nutrition Assistance Program in Puerto Rico, which is not the same as NAP. And I'm presenting this because one of the issues I'm going to touch upon is the food security piece. 26% of those children do not have internet, which is really wasn't that relevant after Maria because nobody had internet, but during other disasters, especially after schools begin closing, which is something we're seeing right now, it becomes really relevant, right? Because when there's a disruption in school, the alternative is to have distance learning. And when you have a fourth of the children that are living in poverty not having any access to internet, that really complicates things. And 10% of children living in poverty in Puerto Rico have some sort of disability or live with a parent that have disability. So that's also an added vulnerability or risk factor. So I'm going to speak to three major themes that we picked up from Hurricane Maria. And I said these themes, we either speaking to them from the research that we did or what we found through the work of the task force working with other entities and with government. The first theme I'm going to talk about is food security. The second will be childcare, and the third will be coordination of services. So food security, I think it's really important to bring this up because in the case of Puerto Rico after Hurricane Maria, there was a massive dislocation of the food supply chain. And everybody had, as this graph shows, pretty much across all income areas, people had issues accessing food. They had difficulties. But it was, of course, this was disproportionate with the families that had the lowest income levels. So as you see, 0.5% of the families that earn less than $15,000 or less a year had some sort of issue accessing food after Maria, and were not able to provide food. Also, other survey data shows us that these families also struggled way beyond the response time accessing food because of the impact, the economic impact. Even a year out, they were still having issues with food security. And so when we think about what this means and how this, in the case of Puerto Rico, because of the high rates of poverty, the food insecurity piece is there even before a disaster, right? And so what are the challenges that we're seeing with this within the context of a disaster, particular to some of the programs, and how can we think about preempting for this? I know we're not supposed to talk about COVID, but you know, some of the things we're seeing them right now too, so that we're seeing a pattern across hurricanes, pandemics, earthquakes that we recently had. And so that is why I decided to bring this up, because it keeps coming up, right? So the school closures, we often think about school closures and the fact that kids are not getting education, but for many children, they are not getting a plate of food, right? And this is the families, how they deal with the food insecurity and the low nutritional assistance benefits that a lot of them have, and that some of them don't even have access to, even if they're like working poor, is through the meals provided at school. So when you have the closure and you don't have access to those lunches, it puts an additional pressure and strain on the family. As I said, the food supply chain after a hurricane in an island or any geographic area that has those limitations is going to be major, right? Something else that we found in the task force, we had a lot of community-based entities, and we also had WEEC as part of the task force. They had a lot of issues getting mailing checks, getting the benefits out. They were still, I don't know in other jurisdictions, but in Puerto Rico, they were still mailing checks. And so this completely disrupted, and a lot of families had issues accessing those benefits. It's happening, it's been happening in this disaster as well. And as I mentioned, you have to think about those low-income working families that are living in the brink of poverty, but do not have access to a nutritional assistance program. So they don't have the EBT card, right? But they just lost employment and now don't have enough income or resources for food. So in terms of opportunities to ensure food security after a natural disaster, I think to the point that Lori was making and the importance of community-based entities and volunteer groups. And in the case of Puerto Rico and in the survey, we found that the community-based entities were the first line of response, or municipalities. By and large, these were the first people that families with children, the first entities that they contacted and helped them. The central government came way later in the response. And not to mention the federal response. And so really, it's important to invest resources in making sure that all these entities are collaborating, have solid preparedness plans, and that they take into account these food pieces, where the food banks are, do they have enough before, if it's an imminent disaster, that they can prepare for. Because I don't think anybody was even thinking that something could be disrupted like this. At one point, you know, we were always told to prepare for 3 days without food, and in some cases, people had issues like up to a month, right? Something that we also think is important, and this is something we've talked about at the congressional level, preparedness transfers. A lot of the families, especially those that are living paycheck to paycheck, they don't have sufficient income to go and do like a preparedness, like go and get like, you know, supplies to prepare in case the hurricane comes. Like they're using the money to buy the food that they need tomorrow. And so while advancing the benefits before the disaster is helpful, because that's something that they do here, you know, if the hurricane's coming in 2 days, here, your benefits are ready, you can go get them today before the disaster comes. So you have that, but it still doesn't solve for the issue that you need extra resources to prepare, right? And so I think the idea of preparedness transfers for nutritional programs or TANF for low-income families with children is really important. Same thing with WEEK, right? Like how do we budget a little extra? So especially around hurricane season right now, people get an extra benefit that they can go out and stock up on stuff. The other thing that I think is promising and is actually emerging right now are the emergency electronic benefit transfers. We're seeing it with pandemic EBT. So to what extent is that a model that maybe now, because of states are investing a lot in the infrastructure of creating these EBT cards, especially for families, like I said, that are those families that don't qualify necessarily for SNAP, but are still low income, qualify for those school lunches. Now that the infrastructure is there, because states are investing in making sure that these people have these EBT cards, how can we continue using that infrastructure to have emergency transfers, right? And I think there's an opportunity there that we cannot ignore, and we need to try to capitalize on. Thinking about early care and education, and this is hugely important from our perspective, because this is not only about the time that the children are spending, it's also about the economic developmental opportunities that these families have to get back into work. And so to the extent that families can get back to work, you know, the less their income will suffer, and so on. So this was part of the representative survey in terms of how education was disrupted for 0 to 5-year-olds in Puerto Rico after Hurricane Maria. And the interesting and difficult thing about this is that in the case of Puerto Rico, the majority of children are not in daycare settings. They're at home or with a family member. There's a lot of informal childcare setups. But so that was 70%. But when we look at the other 30%, which are the children that are in Head Starts or public schools or private centers or whatnot, the average day that they did not attend childcare was 92 days. So this was higher also for the childcare centers than it was even for the schools. I remember, I think the schools, it was 78 days. So we are talking about a major disruption. And I'm going to get a little bit now into why this was, besides the challenges of why the childcare centers did not open. Obviously the electricity and water, like a lot of these centers were not prepared to have a backup generator or a cistern or any of these basic infrastructure needs that emerged after the hurricane. We had quite a few childcare providers and associations in the task force, so a lot of this is anecdotal, but I think it's really valuable. You know, the cash flow, you know, parents are not paying. The government, in the case of unfortunately, at that moment, in the case of Puerto Rico, some of the childcare centers that received vouchers through the childcare program, there was a delay in disbursement. So the hurricane came and sometimes they hadn't received the payments anyway from 2 months ago. So they're already facing cash flow issues. And to what extent can you keep something running when you're not able to pay your teachers or the utilities, et cetera, right? Like it's just, the fact that a lot of them, some of them still stayed open, I'm just amazed. A lot of them worked for free just out of care and love for their students and their families. And a lot of these are small women-owned businesses. And they really just, they did a fantastic job, but it shouldn't be like that, right? And it makes it very difficult for them. I think also, you know, there are a lot of supports that the federal government provides. You can apply for an SBA loan, et cetera, but there's sometimes not a lot of know-how on how to apply for these things, and they can be intimidating. And so to the extent that technical assistance can be provided to apply for these supports, it would be fantastic. I think I put lack of electricity and water there because it was just, it seems something so basic. I put it twice, I just realized, but it was so pervasive, and it's something that without that you really can't have the kids in there, right? And I'll get to some opportunities there and things that were promising. Also, the for-profit entities, some of these childcares are for-profit. They don't qualify for a lot of the donations and supports that were given. So they're kind of in this, they're doing a social service, but they're private. Technically, you know, they're for-profit, so they don't qualify, and they were kind of in this weird gray area. So when we think about opportunities to ensure the continuity of childcare centers, of course, technical assistance and resources to establish continuity of operations plan is important. We're finding actually, and you know, through the task force, we have the collaboration with Resilient Children and Resilient Communities from Columbia University, and we're doing this in 2 regions in Puerto Rico. But you know, we're doing a lot of we've done a lot of workshops around this issue of the plans, and I'm just sometimes surprised that it's up to the civil sector to be doing this. So to what extent is this something that can be more entrenched to help these centers? Again, any type of emergency grant that's going to be given, if they can be dispersed before, so the centers can prepare and can have their cash on hand to withstand the emergency, especially when we know that a hurricane can disrupt everything for so many months. And then, you know, as small businesses, to what extent do we help them get loans and grants for backup generators, solar systems, et cetera, that are going to allow them? Because I honestly, that was, I think, I mean, this is just anecdotal, right? But that was probably like 30% of what accounted for, this is just a number I'm making up, but it was a significant driver in them not opening was just they didn't have water or electricity. You can't have water like that. And so there shouldn't be one daycare center that doesn't have backup generators and water. Anyway, you know, the infrastructure in Puerto Rico is so frail that you do have outages once in a while. And speaking of children, you might hear my baby who's around and making some noise right now. Okay, so in terms of the other thing I wanted to talk about, coordination of services, because this is something that was brought up as part of our guides. You know, a big thing that we saw with the task force, when the task force started, you know, it started with ACF and Save the Children, and initially it was mostly the government agencies on the table, and then Save the Children, and then they started letting some of the nonprofit entities come in. And what was happening in these meetings was people were getting together and kind of like debriefing, because there was no way, like the agencies were getting together and trying to figure out what was happening. There was no way of communication really. So it was like kind of like the only face-to-face and touch point of communication they had. But we, even within that, and this is I almost want to say that this is a personal observation. There was a lot of duplication of efforts and major gaps, and there was no way to track necessarily. A lot of the agencies have the same population. You have housing, you have Department of Family, you have education, and some of them are targeting the same, they even have the same community, and sometimes you have the different agencies bringing resources, you know, 3-4 times to one community, but you have another one where it's they haven't received anything, especially the more remote areas. So that I think was a challenge, and I think, you know, there is even prior to the disaster, if you don't have a previous culture of cross-agency collaboration and coordination, it's going to be really hard in the middle of a disaster. So sometimes we have to think, and I'll talk about how the task forces are promising for that. It's really important to have the nonprofits in the type of task force. I think there is, you know, you can always have an interagency group, but they become echo chambers, and I've seen it when it's only like 1 or 2. You know, all they're doing is saying, we're doing this, we're doing that, and there's not the entities to challenge and question. Look, this is, you know, you're doing this, but I have this community where it's not getting to. So they kind of become these echo chambers if you don't integrate community into those processes. And of course, we have the breakdown of all forms of communication, which makes everything so much more complicated. So children and youth task forces, which is, you know, what we eventually took over at the Institute. And I think ACF and Save the Children did something very wise, which is say, look, we want a local entity to take this over. would you guys be interested? And we said, of course, the task force still exists. And we actually, as I said, are engaged with Columbia University in the Resilient Children, Resilient Communities project. We work around preparedness at the central level. And we also have started doing economic security work. And because of COVID, we've actually been doing some activities around the response to COVID. And so they're really promising because they bring government and community-based entities. They avoid these echo chambers. They allow for challenging the government in a respectful way and having a dialogue about, you know, what's actually happening on the ground and where the gaps are. They allow for quick information gathering. The more people you have, you know, you can do really quick scans of where services are and not. And we did a mental health services scan that happened within like 2 weeks. It was very quick. And we just had people share what they were doing and what the other entity, and because there were so many people, it happened really quick.
Amanda, this is Heather. Sorry, we need to wrap up. We're
okay.
getting a little bit over time. So can you just give a last summary sentence and we'll move on to our next speaker, please?
Yeah. So this was actually just the last slide. So, and then, I just wanted to add that, you know, it can serve as a platform to continue collaboration in the event of a disaster if you continue it in between. But there's, of course, challenges with that. But I can speak a little bit more to the challenges a little later. Yes.
Sorry, Amanda, so much information to put out, so little time. I apologize. David, we're going to turn over to you now, sir.
Okay, and if they could just load the slides, I think they're going to be advancing them for me. And actually, you can actually advance one further slide. So as was already mentioned, I served on the National Commission on Children in Disasters, of which the Administration of Children and Families played a key role and actively contributed. And in our report in 2010, the Commission recommended, one recommendation I do want to highlight on this slide, that HHS should enhance the research agenda for children's disaster, mental, and behavioral health, including psychological first aid, cognitive behavioral interventions, social support interventions, bereavement counseling and support, and programs intended to enhance children's resilience in the aftermath of a disaster. And specifically under this recommendation, the Commission called on HHS to convene a working group of children's disaster mental health and pediatric experts to review the research portfolios of relevant agencies, to identify gaps in knowledge, and recommend a national research agenda across this full spectrum of disaster mental health for children and families. And in 2015, a virtual conference was convened for this purpose. An informal review prior to this conference of NIH grants over the prior 15 years actually documented a paucity of funded research on interventions to promote coping and adjustment for children after disasters. And finding from this conference, as summarized in a report published in 2018 in American Psychologist, highlighted that although there has been some progress in understanding the impacts of disaster on children, far less is known about the effectiveness of interventions to promote behavioral health and coping after a disaster event. The limited intervention studies that were done tended to focus on the treatment or prevention of mental illness, especially trauma disorders. What was critically lacking at the time was study of the effects of interventions on distress and bereavement, as well as the promotion of adjustment and coping. And one barrier that was discussed was the absence of valid measures of these outcomes and the demonstration of their usefulness to research funders and to policymakers. So evidence-based interventions have therefore tended to focus on the prevention or treatment of post-traumatic stress disorder, for which there are validated measures. If you can go on to the next slide. The group concluded that developing evidence-based interventions for children experiencing disaster is a national priority, and that such research should be broadened beyond studying the prevalence of trauma and other mental health symptoms and the impact of trauma approaches, to instead include the full spectrum of outcomes, such as bereavement, distress that doesn't reach clinical levels of a mental health diagnosis, adjustment, coping, and resilience, as well as the study of interventions in each of these domains. And I will say the gap remains today, and so should the urgency to address it. So in order to highlight this point further, I want to just comment on some of the differences in the way we approach trauma and grief. Although trauma and grief often co-occur in the lives of children, as I saw extensively in all of my visits to New Orleans after Hurricane Katrina and to Paradise after the wildfires, and in many other disasters in between, the fields of trauma treatment and childhood bereavement actually have far less overlap than you'd imagine. If you think about it, the common reactions seen after the death of a close family member or friend are often viewed in the mental health field as normative reactions that, while they might benefit from support, they don't generally require treatment per se, because bereavement's not considered a mental illness. Bereavement support is generally therefore provided by lay people or faith-based organizations, and often at no cost to families, and therefore at no reimbursement to the professionals who provide that. And not surprisingly, therefore, they're infrequently evaluated through formal research. In contrast, many of the same reactions, such as sleep problems, feeling anxious, when they're seen after a traumatic event, they're then viewed as symptoms, and when they're sufficient in number and duration, they characterize a mental illness, such as PTSD, and are felt to require treatment. And then trauma treatment is provided by licensed and credentialed mental health professionals and generally covered by health insurance. Now, although many have come to accept these distinctions, a common view voiced by those who actually experience traumatic events that don't cause loss of life is a relief that at least no one died. And to suggest then that bereavement is categorically less of a hardship than trauma is inconsistent with many, if not most, people's lived experience. I've also been frequently reminded as well that death of a parent isn't one of the more classically considered adverse childhood experiences, although parental divorce and incarceration are, as if at some level it would be better to have your parent die than to have them be divorced, which I don't think is anyone's real belief. And I will just comment throughout the presentations, I've seen a lot of mention of trauma and understanding the impact of trauma, but not as much mention about the impact of loss and other adjustment difficulties. Now, the National Center for School Crisis and Bereavement, which I direct, is actually a lead founding organizational member, along with the New York Life Foundation, of the Coalition to Support Grieving Students. And this coalition now has 100 organizational members, including some of the top educational and health professional organizations, such as the American Academy of Pediatrics, and Save the Children is also a supporting organizational member. And we all share the common conviction that no child should grieve alone. And we've developed a wide range of publicly available and free video-based and print materials for professional development and parent and family education at our website, grievingstudents.org. And I mention these because they're publicly available and they're all free of charge. So I wanted to highlight just two remaining areas of limited research. As already mentioned, there's very little research on the efficacy of prevention initiatives involving children in disasters. Children's stories, coloring books, and parent guidance are often quickly developed and then widely disseminated by federal agencies and non-governmental organizations in the aftermath of a disaster, generally without any pre-existing evidence base, and really most concerning to me, without any attempt to collect the evidence to guide future use. Even more formal prevention initiatives, educating children on how to prepare for disasters that typically lack prior evaluation, even including those being promoted for broad use in schools. And I recognize that some students and school personnel may feel empowered by these initiatives and feel that it somehow better prepares them for possible events. But these individuals may, however, underestimate how those with different personalities, coping styles, personal histories, and individual vulnerabilities may instead respond. And children who receive training on how to respond in the event of a disaster may feel comforted even when it provides them only with an illusion of control. However, such efforts could result in increased guilt if the individual is not able to respond in the idealized fashion in a real event and death or serious injury occurs. So these and other unintended consequences really should be carefully considered, and the programs should be evaluated more consistently for efficacy before they're being widely implemented. The last point I wanted to bring out is I want to highlight the need for more study and intervention for caregivers of children after disaster, which is an area that is not well addressed. And I want to give one example. I was providing some training for foster parents in the aftermath of Superstorm Sandy, and I was talking about the long-term impact of disasters as well as the potential for post-traumatic growth. And one of the foster fathers asked to share his story, which I'd like to share with you. He told me that he was, I believe he was working in finance, may have been on Wall Street. He was a young gentleman. He was very successful in terms of his career. He was happily married and he had a toddler. And he said that prior to the superstorm, what had happened was that his child became ill and died suddenly. And he said, and at that point, he started to question a lot of the decisions he had made in his life, including the decision for his career. And I'm not trying to make a criticism of those who work in finance, but he said he started to realize that his work in finance was making him a lot of money, but it wasn't really contributing to society in a way that he thought was meaningful. And so even though he was making a lot of money in finance, he quit his job and went back to college to become a kindergarten teacher. And he said, being a kindergarten teacher, shaping the life of a young child, that is a career. Finance is a job. And then he became a foster parent, and he was in the process of adopting a young child when Superstorm Sandy occurred. Now, the reason I mention this is that his story is not that unique. Many individuals that enter child-serving fields such as education, social services, child mental health, pediatrics, and others do so because they've experienced childhood trauma, loss, or some other form of adversity in their own past. And they either benefited from the help of others and decided they want to do that as well, or they recognize the impact of the lack of such assistance in their own life. And it may be, and often is, what make them commit to focus their career on ensuring that children receive that critical support. And I would say that this would probably include the majority of foster and adoptive parents served by ACF, as well as the professionals in those fields as well. But the problem is that when disasters do occur, it tends to uncover prior trauma and loss in the lives of the helpers in the profession. And so ironically, those that devote their lives to helping children are actually most likely in many ways to be hurt personally by doing so. And the striking lack of evidence-based professional self-care interventions, I think, is therefore a particularly important critical gap. And particularly in these professions, we don't actually need major disasters before children can be helped and the professionals themselves can be hurt by helping them. It can happen on a day-to-day basis. So I think that training and support becomes particularly critical. So I'm going to stop there so we have more time for questions. And thank you for the opportunity to speak on the panel.
And thank you, David. You brought up some great points as well. So right now we're going to move into the question and answer part of our panel. I'm going to start this off with a question or two questions for each of our panelists. Audience members, if you have questions or comments, please put them in the Q&A box. Remember to state your name and affiliation for the record. Okay, so my question, looking at the documents like the National Commission on Children Disaster and real world events like Superstorm Sandy, Hurricanes Harvey, Irma, Maria, and the Paradise wildfires, what is the #1 gap you feel that we have addressed since Hurricane Katrina? And the second question is, what do you think is the most important gap that we have still not managed to close since that same time period? So I'm going to go backwards and start with David this time.
Okay, so I think as already mentioned before, I think one of the gaps that we started to address was recognizing that children are impacted by these events. I think there really wasn't a great deal of consideration for the impact on children, instead seeing them as being resilient and that, you know, they'll get over this and that they don't have problems. And I think we've recognized that's not the case. And as already mentioned, ACF FEMA started case management and other services. So the case management, case management in FEMA, for example, around children's needs and creating a children's coordinator was something new. I know that was something that we discussed in the commission and really is a major advance. So now we're able to see, to the second part of your question, all the gaps that remain. So we've done a pretty good job of identifying that adverse experiences cause adversity. To some level, I think many of us already knew that, but we haven't made as much progress as to figure out now what do we do to prevent that or support or ameliorate that. And as I mentioned, we've tended to use a medical model, which has looked more for screening, diagnosis, referral, and treatment for mental illness. But I think what we found in other studies that have been done, such as some of the work done in New York City after 9/11, the vast majority of children will have impacts. So in work done in New York City schools, it was about 87% of children had a persistent adjustment problem 6 months after 9/11. And we also found out that the majority of children who self-identified behavioral health problems and self-identified changes in daily functioning also reported they had not sought or received any mental health support either within school or outside of school. And that was despite the fact that New York City schools had therapists in every school to offer free mental health services due to money that they received from recovery efforts. And if we look at our current situation now, I think we're going to have more than 87% of the children having impacts, and we're not going to have the funding to increase mental health services. And in many situations, budgets are going to be highly constrained and mental health staff will be reduced in order to meet budget shortfalls. So I think we know there's a problem now, and that's awareness is good, but delivery of support and services is not following our awareness at this point.
Thank you, David. Great points. Amanda.
I think something that I think is still missing in the conversation are the issues around how economic insecurity and poverty impact children. Poverty matters, right? And these disasters usually deepen it in a lot of households with children. And so I think a lot of times we're having conversations about trauma, we're having conversations around access to education, but we're not acknowledging this common denominator that a lot of children, especially those that are usually most impacted, their homes are most impacted, right, that have the biggest losses are facing. And so I think we really need to start bringing into a conversation, and also as we start thinking about recovery, ensuring that the economic security of their families is a priority, because it's a lot around that, quite honestly. Short and sweet.
Yeah. Lori.
Thank you. And I just wanted to say to David and Amanda how much I appreciated your presentations, and thank you for this question, Heather. I think one of the biggest points of progress, right, is exactly what David said about the focus on children and youth. The fact that here we are in 2020 having an entire workshop dedicated to this, seeing all of the progress that has been made in terms of research and service provision and policy making. And I think so much of that does trace back to this National Commission report. And so really wanting to uplift that. I also think one of the things that Alice and I say at the beginning of Children of Katrina is that children were sort of long depicted in these sort of contradictory ways. They were either like little red rubber balls that would just bounce back after disaster, so they're hyper resilient, or when they were talked about at all, they were like vulnerable victims that had to be completely cared for and protected. And I think something big that the National Commission did was it brought in a much more complex sort of depiction of children and the many systems that surround children's lives. And so I think that's a major contribution that should not be understated. I think the biggest gap, there are various gaps, and that's why we're here together. But I want to pick up on what Roberta said this morning during her opening remarks, especially about the educational system and about the forward progress that we really need to see to ensure educational continuity in the aftermath of disaster. And that's going to start with deeming schools as critical infrastructure to ensure that those school buildings are made safe, so that actual infrastructure, but then also that they're treated as a core part of our various systems. And that is a real recognition that children's #1 job is to learn. And so that means sort of centering schools and childcare centers in new and different kinds of ways. So that's one of the various gaps I'd love to see further progress on. Thank you.
Excellent. And Yes, one of those things I've been saying as well. Absolutely. We have a lot of questions, so I'm going to start at the top here. Michael Prasad wanted to know about, thinks we should raise the level of awareness and action around children disaster for federal, state, county, parish, tribal, territorial emergency managers. Do we need to consider it as an ESF, an emergency support function itself? Maybe adding it to sticker training and including roles in NIMS resource typing, etc. Some of the conversations that we've kicked around which is related to this is there the proper amount of coordination between ESF 6 and ESF 8 in relation to children disaster issues? So Lori, do you want to start with this and we'll go across to everyone?
Yes, and I thank you so much for that question and for raising that. And I don't have an answer to that other than to say I think that is a critical conversation that needs to be had, especially about what does it mean when we're becoming our own sort of stovepipe over here. What does that mean in terms of recognition, but also in terms of integration and the possibilities for both recognition, but also integration across the ESFs. And so just thank you for the question. And I think it could be a workshop in and of itself. And I think it is a conversation that needs to be had on behalf of 25% of our population. Thank you.
Amanda, do you have some perspective from what you saw in Puerto Rico on that one?
No, not really on that one. I'll pass that one. I don't want to speak to him. Yeah.
Okay, David?
Yeah, so what I will say is that when we were on the commission, one of the issues that had come up was the prioritization of children's needs. And so I'm going to use an example. There was some discussion of the Strategic National Stockpile and how at the time there were major gaps in what was available for children. There's many reasons for this, but one of the reasons is the cost. And if there was some discussion of a policy that they should have material that will save the most lives. So that, what is the dollar spent on a life saved? And it was mentioned that children would be more expensive because some of the medications need to be in liquid format, they expire, they have they're more expensive to store for many reasons. And so there was actually a survey that was done, a national survey, looking at the general community's preferences. And they were asked if it would cost more to prepare for a child's needs, would you support that? And the numbers were quite high. A lot of this children and women first when there's a disaster, like in boats that are sinking, even the Titanic. So people say that, but our federal policy wasn't following that. So one of the things I would say is that individuals in a disaster, even in a natural disaster, as was mentioned yesterday, if you're worried about your kid's safety, you will place yourself at risk to try and save your child. So you'll go to the school to try and rescue them, even if that is dangerous. And so for many reasons, we first off have to recognize that the general public does value children and see them as our future. And therefore, we do need to attend to their needs. But also, even if you're just going to do it from a business perspective, if you don't take care of children, then parents won't take care of themselves. And so we need to make sure that we're responding to the needs of children, if only to respond to the needs of the adults as well. We're seeing that right now in the pandemic, that parents, yes, they're worried about getting schools open so their children are watched so they can get back to work, but they're also worried about their kids and they want to make sure their kids are taken care of, and they will place their children first. So I think that, yes, we should be elevating it for multiple reasons. As a pediatrician, I think we should put kids first because they're kids. And so the last thing I'll say is at one point I remember somebody, and I won't mention who, saying that they couldn't focus on the needs of children because that was a special population. And I pointed out that everyone is or was a child. It's not a special population, it's all of us. It's just a time period in all of our lives, and it's an important, vulnerable, and critical time period. So it really deserves, I think, some special attention.
Best argument against the special population argument I think I've heard. Thank you. Very good. A lot of great answers. Another question that came up here from Patricia Frost. Data matters. How can we promote requirements for the adoption of uniform data collection based on appropriate age groups to inform and drive interventions in disaster? And again, she said we're seeing this during COVID. Does anybody have thoughts or recommendations on that? I see Lori's head nodding. I'll go to her first.
A great question, and having data is so important, right? To understand gaps and to understand possibilities. And so I know the question was about sort of promoting requirements. And so I'm actually going to speak. I know that there may be particular requirements in particular organizations or agencies, but I wanted to speak about something we're trying to promote in terms of a kind of grassroots bottom-up data sharing in the academic community, of trying to encourage, not require, but encourage researchers to publish their data through the National Science Foundation funded Design Safe Cyber Infrastructure. And we actually have a partnership with them. It was predominantly created for engineers, but we had a partnership to ensure that it was accessible to social and behavioral scientists as well. And our big argument around that is that when we publish not just our data, but also our data collection instruments, our data collection protocols, that increases our possibility for comparison across disaster, and so that we can start looking for the trends and patterns across time and place. And so we're actually, in 2 weeks, we're having our big first Publish Your Data event for social and behavioral scientists, again, to try to encourage that kind of grassroots, let's share our data when we can, and when we can do it safely and securely, so that we can ensure those comparisons. So we're trying the sort of carrot rather than data requirement stick, to see how much we can get some of that sharing going, to allow for some of that cross disaster comparison that people have been calling for decades. Thank you.
I think this is something we have thought about a lot too, in this setting and other settings. And, you know, a lot of the government programs are being administered by providers, right? Service providers, for profit or nonprofit, and they have contracts with the government, and they're getting grants to run these programs. So to what extent are these requirements that we are making of these service providers, in terms of, you know, can that not be one of the things that they're required to do, right? And can this not be written into contracts, whether it's in the context of a disaster or whatever it is? But, you know, they're more from that stick perspective, but, you know, their contracts, we are, you know, the government's giving them money to execute something, so require them to collect the data if they want to keep the grants. I don't know.
Amanda, between me and you, we could have a carrot and a stick and make it all work.
Yeah.
I can also add along those lines, I know that when the commission looked at this, one of the areas, for example, was that FEMA wasn't necessarily routinely inquiring and documenting whether a displaced family had children. And we also found, for example, that shelters didn't necessarily have equipment and supplies for children. And even when they did for children, they tended to include anyone 0 to 18 as a child. And the problem is that, particularly if you're talking about like food and equipment and bedding and things, it's very different for an infant than it is for a 17-year-old. And so one of the things I remember seeing was I was in China after the earthquake in Sichuan province that killed 69,000 people in one day. And somebody showed a slide, and it was a picture actually of a first responder. It was a woman, and she was breastfeeding an infant in the rubble. And the comment was made that that wasn't her child. The mother had actually died, and they didn't have formula. And so if she didn't breastfeed, the child just would have died. So the issue is, we weren't I think we were better than that situation in our shelters, but we weren't requiring it. And so I think, as already was mentioned, a shelter can open, and it doesn't necessarily have to have formula in it. And so they may still get funding for having sheltering services. And so, at least at a voluntary level, there were certain minimal requirements about what you had to have in a shelter. But maybe we have to think about whether we tie that into whether or not they can even get reimbursed as a shelter. So I completely agree, we can use a carrot and a stick, but the bottom line is, for some of the basic needs of children, they're life-saving, and we have to make sure that they are present one way or another.
Thank you all, great points. We have another question out there for Amanda. They ask, how active was the Puerto Rico Emergency Management Agency and a lot of the efforts you talked about when you were talking about those gaps?
Well, they weren't, I think they initially participated in the task force when it was just a response, you know, the first weeks, but they weren't really engaged after that. FEMA was engaged, but the local agency really wasn't. I think also, you know, after the initial response period, which I want to say we were kind of in that emergency mode for, felt like a long time, but you know, a couple of months after that, the task force swiftly moved into thinking more about recovery and what was happening around mental health. So they kind of moved on to what is traditionally not thought of as emergency, but still should be. So no, we didn't have a lot of engagement from them, to be quite honest. They were more engaged after when we did this study and we presented some of the recommendations. They at that point down the line they were receptive, but they weren't involved in the task force.
Thank you. We have a question from Donna Wolf. Donna's a psychology instructor and school counselor. She says, I have reviewed research on school-based mental health centers in high schools. This structure would be an effective way to utilize youth and adult anchors in mitigation and recovery. And she'd like to hear the panelists' thoughts on that idea. So why don't we start with David on that?
Yeah, so we know that school-based mental health centers, as well as just school-based clinics, we have to recognize in school-based clinics, they have integration of behavioral health services within them. And a lot of the professionals, school nurses, for example, look at both psychological issues as well as physical issues. They often, by the way, co-present. So individuals in crisis situations will often have physical symptoms. Sometimes it's due to stress hormones causing physical problems, like increases in blood pressure, worsening of asthma, worsening of diabetes control. But sometimes it also causes psychological factors, which present as physical symptoms. And quite honestly, it's usually both, some combination. So yes, whether those are school-based mental health clinics or whether those are school-based clinics that include mental health providers that are integrated, I think both of those are a lot of the mechanisms that are used effectively. So for example, I know there was a wellness center that was created at Marjory Stoneman Douglas after the shooting that occurred there. And they actually placed in that clinic, which was predominantly mental health providers, one full-time nurse. So that they could also have integrated assessments and services. They had a separate school health clinic where they had a nurse, but they wanted to make it all in one site. However it's set up, I think we need a balance of physical health and mental health services, and ideally they would be integrated. And quite honestly, that's often one of the best ways to provide services, because it's hard for families to access services outside of school. But both of them are needed. Some families will actually prefer, and students would prefer, not to be seen in school because they want some privacy and distance between their school setting and their mental health services. So I think we need to offer both. And we should have that at baseline, even outside of a disaster.
Yeah, I mean, I would agree. That was one of the greatest gaps that we found when we did the research for mental health supports in the community. And so to the extent that those can be in a school, which is kind of very central to the community, people gravitate there, that would be really helpful. Something that I've been really thinking about is, in the event, God forbid, that we have a major hurricane this season, what does that look like in the COVID context? Right, when people can't congregate. So I don't have an answer for that, but I think it's a question that we really need to raise and acknowledge that if we have the combination of a hurricane and a pandemic, it further complicates the mental health, not just the mental health challenges that families are going to have, but also the access to services and community-based support. I mean, community-based or school-based support. Just a question to raise and something we need to be thinking about.
And I will just say that I know there has been some discussion about sheltering during a natural disaster such as a hurricane currently during a pandemic. I haven't read all those guidelines. My guess is that they predominantly deal with physical distancing and infection control and less so with the behavioral health aspect. But I know people have already started to consider about how can you even establish a safe shelter during a pandemic, because disasters do co-occur. They co-occur in people's lives, but also in communities.
I'll say really quickly in response to that question that I think it's a beautiful question, but I also think sort of the broader question around it too is how do we get the resources to children that they need? And if that's sort of the most basic question, I know that a lot of times we do turn to schools for obvious reasons, but then children are only in school for a certain % of their lives. Schools are obviously very overtaxed in a variety of ways. And so if we think about this as another place to potentially center children's voices and to center children's requests for where they would like to receive the services. And so many of the things that we learned, sort of picking up on what David and Amanda just said about kind of that schools may not be the places where, for a variety of reasons, that children or families want to access resources. And so then really asking children, where are you getting the things that you need? Where are the spaces where you feel safe? Who are the advocates and anchors in your life who you trust to provide you the things that you need? And so I just think this is, again, this important moment to really learn from children and youth and to really observe where it is that they're receiving these services, which I know, again, so many people on this call today, this is what you're really dedicating to figure out that question, so then we can get those vital resources to children and youth.
And also to build on what Amanda said earlier about vulnerable populations, one group in particular that I see has difficulty accessing services are individuals who don't have legal status in this country. And particularly recently, many of them will not access shelters. They may not go to Red Cross sites, anything they see as government or government affiliated in any way. And so they often turn only to their schools. So I've been in one of the wildfires that was mentioned. I was meeting with the principal of an elementary school. It was probably several weeks after the wildfire, but the school had still not reopened. And she was just unpacking water from the trunk of her car. And she said that families would only come to the school for water, for safe drinking water. And I kind of looked at her and I said, well, that's great that you're doing it, but you have kids that died in the school. You're trying to reopen your school and clean it. You can't really, as the school leader, be unpacking water every morning. So we have to figure out how to form better partnerships so that if kids and families want to get services at school, then we have to make sure other people come into the school and deliver the resources to do that. Shouldn't be part of the school's budget, shouldn't be the school staff to try and put it together. And as Lori mentioned, I can tell you after 9/11, I worked with New York City schools in the recovery, and there were kids who would not, their families did not tell the school a parent died on 9/11 because they didn't want to be one of the 9/11 kids. And so they would not even disclose that a death had occurred from a very public event. And so some kids and some staff don't want to get their services at school. And actually, after some large disasters, I've seen they don't even want it in their own community. They want to go to an adjoining community where they feel they can get some privacy. So I would echo what Lori said, is we have to find out from kids and adults, where do they want to get the support? And we have to provide a menu of options. But we have to also provide the finances and the resources to deliver those services, and not just expect the schools to pick up yet another thing when they're struggling so much financially.
And thank you, everybody. Again, I apologize. We have met, I think, reached the end of our time.